60,000. And the total deaths have gone up to around 9,951, which is a really staggering amount. And our country is in chaos. The reason we Hello guys, really sorry about the technical issue. So as I emphasized on the current situation of the COVID-19 which is happening in the country, we decided that we have to step up and then we have to organize the webinar series, which should be an informative session for you all to take. So we have two renowned speakers, Dr. Namal Vijay Singh and Mr. Hemal. So first of all, I would like Dr. Namal to introduce himself, and then Mr. Hemal can proceed.
Hi, thanks. Thank you so much for having me today for your program. I really appreciate the team of youngsters doing this kind of work. Just to tell you about myself, I'm based in Negombo. I went to Maristella College, currently practicing as a medical officer at Kothawala Defense University Hospital in the COVID ICU. And I also head the clinical operations at Remedium One, which is a clinical trial organization affiliated with University of Kelaniya. So I'm into basically like in goodwill ambassadors, like there's a non-governmental organization help the poor who are in need. And also we have another human rights fundamental organization, and I have a director position at that organization in the field of sports and nutrition. Thank you.
Mr. Hemal, you can proceed.
Yes, Iransha, thank you very much for having me on this special day. I guess you guys can see me clearly. Yes, I'm Hemal Madhusankar, currently working as a manager at Catside Gym and Nutrition. Also, I'm a physical fitness trainer, working as a senior physical fitness trainer there. Also, I'm studying sports psychology diploma as well as strength and conditioning national diploma in Sri Lanka. Also, I have been coaching more than like 2,000 to 5,000 athletes in Sri Lanka. So hope to give you hard push on how to stay physically stable on this pandemic situation, especially on this COVID-19 pandemic. So let's proceed.
Yes, Mr. Hemal. So we have received a ton of questions, and from that we've selected a few questions for you all to answer. So the first question is directed to Mr. Hemal. How to be in good health at home without going to the gym? You know, we used to go to the gym and get healthy and get all those muscles, but now we have to stay home, and because of that, most of the time, even us, we spend most of the time on bed. So how do you think that we should do to stay healthy at home?
Yeah, it's like this, Iration and my dear friends. Like stay physically healthy is not mean that you must go to the gym. So physical health is not like lifting weight only. The physical activity is that can be performed by in your place by sitting on a chair as well. Like if you can move your skeletal muscles, like do some stretching and also jumpings, stair climbings, So those are activities that can be performed by at home. So it doesn't mean, Irshan, that we must go to the gym to perform the physical activity. So if I get a clear approach to this topic, Iransha, right? Iransha.
Yeah, it's
Yeah, Iransha. Like, so we are not focusing on the COVID tested and positive people here. Like, we are focusing on the target. The target crowd is the who are quarantined at home during this pandemic, as well as the people who are tested and positive COVID and quarantined at home. So both of them can perform the physical activity at home without going to the gym. If we divided these these categories into two, like those who are in home, like I mean the healthy people, so they can even do the home activities like sweeping, breaking cobwebs, and do some gardening. So those are the physical activities we can do at home. And if we have to go for a particular schedule, or if we need to make a particular schedule for the target people, like assume Iransha, that I need to lose some weight, at least I need to lose some pound. So you can, the basic thing is to do cardio exercise plus to manage our diet. And also, Iransha, that assume someone needs to gain some muscles while we are at home. So again, the diet and the resistance training, but that has to be what we call, that has to be very professional. That has to be take as a professional way. So you must meet your physical trainer in order to get the prepared workout plan to do at your home. So as I said, basically the physical activity can perform at home by do your household activities, as well as you can do some push-ups, you can climb your stairs, you can jog, you can run, you can put a music and dance. So those are the activities that we can perform at home. So like you will definitely ask from me that the COVID positive patient, how they can do a physical activity, and is it okay? Is it okay to do physical activity while we are tested positive COVID-19? Dr. Namal will give approach for that. So I'll until post that part, Iransha. So basically, the physical activity does not mean we must go to the gym and lift the weights or do some cardio. We can arrange some weights at home, like you can use water bottles to do some barbell curls or the biceps curls, or you can do some perform shoulder presses even with the water bottles. And I have seen during this pandemic situation, most of the pro athletes are performing the activities, the physical activity, by using them. Even the empty gases are quite expensive, these days, but you can use gas, empty gases, as well as like the plant pots, or whatever the convenient and safe for the exercises. So burpees, lunges, sit-ups, those are the activities. But the only thing is, Iransha, we have to go with the order. Like it has to be it has to be done by the qualified physical trainer. Iransha, we don't know, it's not suitable to do all the physical activity at once for the sake of I'm saying. It has to be in order. So so likewise, we can do the physical activities. Doesn't mean that we must go to the gym and lift the weight.
Yes. Yes. Okay, so the next question is directed to Dr. Namal. So is there a stigma when it comes to talking about mental health and prioritizing it? Is there a stigma?
Iransha, so let me put it this way. Basically, in a country like Sri Lanka, like when you talk about psychology and emotional point of view, those who do not have a strong psychic are considered to be weak people. Say, for example, there is a big stigma among people when you have a psychologically ill patient or a person at home. So those who are like they're saying simply say that the strongest, the fittest of the what do you call the survival of the fittest. So that means not only the physical but also the emotional and the mental part matters a lot. So there is obvious stigma going on among the cultures like Sri Lanka or in Asia, where most of the people are being considered or looked down upon. Those days when we see people who are psychologically unstable, we used to or tease them or throw stones at them. Like I have seen in my childhood how bad it is in countries like ours. Like most of the people were not considered as human beings. So, but now the trend is a little bit changed. Most of the people are updated. I think like a team of youngsters like you have a vast amount of knowledge and a little bit of more empathy, if I may say, in terms of looking at people, and also more of good heart by whatever the platforms that you're using right now. So with those, I think most of the people are a little bit broad-minded, and they have a little bit of more knowledge, and they are slowly skipping away from the stigma. So they tend to understand this as a disease, and those who are affected, they are seeking a more higher professional opinion in terms of treating them medically, as well as improving their behaviors and attitudes. I suppose I answered your question, Iransha.
Yes, yes. I have another question for you, Dr. Hema, Dr. Nama, sorry. Now let me put it this way. I have a question, but let me emphasize it more. Because of the current situation, the economy has gone down, and it's really hard for middle class people. And because of there's another reason that people are more stressed, because they can't go out, and they don't know even if they get COVID. Now, if they get a cold, we know because it gives symptoms. But COVID doesn't give symptoms until some time passes. So because of that, it's really hard to keep a positive mindset. How would you tell us and the people here to have a positive mindset, to maintain a positive mindset?
Okay, so so let me put it this way. So if I can just can I share my screen, Iransha?
Yeah, sure. Go ahead.
All right. Okay. So there are few slides that I got ready for the presentation. If I'm given time, Iransha, just few minutes. So
yeah, sure. Go ahead.
Yeah, of course, Iransha, and everybody, I don't know, you all are from various platforms. I'm trying my best to stick it to a more simple way. So basically, if you look at this slide, it says healthy body, healthy mind, and you get a happy person. Okay, so my basic intention of today's the thing that you wanted me to be in the program is more or less talk towards about the mental health, where Hema get in touch with more of the physical part. So we all want to be happy, right? Whatever said and done, at the end of the day, we all want to be happy people. So nobody want to be sad. So if you have a healthy body, one part is covered, and if you have a healthy mind, the other part is covered. So always focus on this area. So I'll leave the healthy body part to Hema, where I will drill a little bit more deep into the healthy mind part. So if you really consider about what is health, is basically consideration of four main aspects. That is physically, emotionally, and mentally and socially. There are four main aspects of health. So, so the question that you asked me about the positive attitude when you are impacted with a pandemic situation like this is basically not a new thing, because pandemics are happening in decades or in centuries time. There are a lot of illnesses that were there that wiped up so many humans for a long period of time. If I'm just to scroll down and show you guys a few things here. So if you see this slide, the Black Death, even the plague, the smallpox, and you come down to Spanish flu, and again the third wave of plague, and again HIV, those are kind of pandemics that we had for a long time, up and down. Like you see the proportion of the people on your right hand side, the total number of deaths. So the Black Death actually occurred in 1,300, and there are around 200 million people who died from this illness. And also, like when you come down, you can see the population affected is around 50%, half of the population were affected. And you really look at the Spanish flu, again 45 million people died. Still with COVID, we have around 219 million cases with 4.5 million deaths all over the world. So pandemics are like it comes time to time. Here, of course, what happened was this COVID virus is said to be RNA virus. Some people tend to think this is a bacteria, which is a wrong thing. And some people still believe that this is engineered or biologically developed weapon kind of thing. Still, there's no direct proof on that. So we will not speak on myths and like people like who create a lot of unnecessary agitation among the public. So it's a virus that spreads from droplets. So it doesn't, like people tend to think that it may get spreaded from mosquitoes and houseflies and all that. It doesn't happen like that. So it's a droplet respiratory virus. Okay. So these viruses has been there for a very long time. So early it was called MERS, and there was some form of called SARS. And here comes COVID in 2019 December. So these are said to be viruses, and if you can see from this slide, there are spike proteins which are being technically addressed during the vaccine development, and also like there are certain things like nitrous oxide sprays that are coming in the future to prevent and to treat these kind of illnesses. So the RNA is the nucleotide strand that I have shown here in blue. So these all are being considered in the phase of vaccine development. So you asked me about how to stay positively in a pandemic situation like this. Is basically there are few things that we can use to have a mental relief when we are faced with the pandemic. For example, like if I give you few things to be mentally strong in life. For example, like when you are stuck to a house. When you are confined to a room, you are not allowed to move, or you are not allowed to like enjoy your life like you have enjoyed earlier in a situation like a lockdown, or in a situation like people have been addressed to stay at home, or else like practice social distancing, like the parties are no more there. Sometimes like people are not who they are. So there's the concept called the new normal. So there are concepts of biobubbles. People like tend to have relationships in a more confined way. So actually the pandemic has created a lot of different impacts on the society. So as you can see, those days we used to eat together. Sometimes it's not possible even inside one home. Sometimes your parents eat separately, and those who are infected or maybe with mild diseases has to eat inside their own rooms, wash like do their activities separately. So there is a lot of stresses happening. Like this is actually a social part. So when you really think about the financial part as well, there's a huge crisis among people who are like earning their daily wages. So that's also a huge impact that society has to think about at this moment. But whatever said and done, this pandemic will pass. There's great hope in the future. So with the vaccine, which are actually emerging at the moment, if I have time, if you have any questions about the vaccines, also I have a few slides to share with you guys. So I'll speak about it. So the idea is the virus will be there. The COVID is here to stay. It will, there will not be a day that we will not get COVID ever. So the COVID virus will be there. The SARS-CoV-2 virus will be definitely there. So the only thing that we can do is that we can control this by practicing, at least for the time being, for about actually a minimum of 5 to 6 months for the time being, like strict social distancing, as well as wearing the mask, have the hand sanitizers and hand washing, as well as getting the vaccine. For you all youngsters who are here, I believe you all have got the vaccine by now, at least the first dose. And actually you need to get the second dose as well. It doesn't matter whether it's Pfizer, Moderna, AstraZeneca, or Sinopharm or whatever. So the most important thing is get the vaccine as early as possible. So don't go behind these vaccine efficacies at the moment. So whatever that's available at the moment is very safe. Don't worry about it. So get the 2 vaccines. So because it takes time for you to get the full immunity in time. So as you said, There are cases that has been reported where you don't get an illness at all. That's called asymptomatic illness. So you may have the virus, but then again, you will not get symptoms. So there's an incubation period. So after the incubation period, there comes this infectious period where the person starts shedding. So basically like around 1 to 5 days, you will not get any symptoms at all. So once you are infected with the virus for about 5 days, you will not get any symptom. So after about 5 to 15 days, you will start spreading this virus, and also you will get symptoms basically starting from, so you will get basically a symptom of headache first, or maybe a little bit of abdominal pain. Sometimes more or less people ended up with having dry cough, stuffy nose, or sore throat and things like that. But main symptom in COVID and other flu-like illnesses or common cold, it's fever. Okay, so those who have only a simple headache or a runny nose, don't think it's COVID and try to do antigen testing, go behind PCR people, calling people at home. So that's not going to work. You're just going to like destroy all the resources around. So don't do that kind of thing. People tend to tell most of the go and get a PCR done, or go and get antigen done. So it has become fashion, and it has become a social killer at the moment. So don't do that. So simple runny nose or a cough is not COVID. Okay, so so treat yourself first. Okay, go to a doctor, wear a mask, wear gloves if possible, or else like go and talk to a doctor first. So the doctor will definitely analyze whatever the symptoms that you are having. So during this period, it's always advisable for you to stay at home. So if you have a fever, simple fever, maybe like around 100, or a cough and a cold, don't start going out. Treat yourself at home. Always anticipate whoever comes first to your place, or else like think at the moment you have COVID. Okay, so treat yourself, go to a doctor and treat yourself, then stay at home. So if the doctor will definitely guide you what to do on your day 1 fever, day 2 days of fever, maybe 3 days, 4 days, 5 days, he will definitely say when to do an antigen test or a PCR. So having it done on the very first day or the second day will give you a lot of negative reports. Okay, so don't do that. So have a general idea about the illness. So Iransh asked me a basic question about like me having stressed about COVID and also not being able to move out. Okay, so I think with the knowledge that you gathered about COVID and how the symptoms come up and how well you can get treated, rather than like saying, oh my God, I have COVID, I have headache, it's COVID, it's definitely COVID. So people like used to like be very worried about this. Be worried, yes, but don't get very anxious, don't get panicked about it. Sometimes it's hard to find people now. It's almost like more than like roughly about if you take 10 people, it's at least 1 or 2 people are affected with COVID. Okay, so Sri Lanka, as you said, is at a very chaos situation at the beginning of your description. So we'll try our best to get this under control. So don't feel bad about what's going on around. So if you stop at where you are at the moment with the illnesses, with the problems that you have, you will be stuck at that point. So always try to find solutions, because what I have seen is the business model that you are on, whatever the business that you're on, whatever the thing that you're doing, studies, maybe a job or maybe something else, take time to study, take time to spend valuable time with your loved ones and families, and also like do some little bit of more innovative thinking. Okay, so I think like you don't have to be stressed about so many things, because what we have at the moment is like maybe let's say money. We should not be greedy at the moment. Okay, we should earn some money to make a living. Okay, like this is not the time to like earn millions and millions, or like be buying a lot of lands or buying a lot of vehicles, or else like buying jewelries. This is not the time for that. So we have to survive this pandemic first. Okay, so most important thing is being strong with the knowledge around, and also like listen to the people who have the knowledge, rather than going behind all the cram around the social media, and also the big accelerated hyper situations where you see sometimes on news or sometimes on newspapers. So always get correct information from correct people. Okay, that's one of the most important things for you to prevent you being stressed. Okay, so if you want to think positive, you need to gather a lot of good knowledge, and also like you need to address this from knowledgeable people and educated people. I think that was long answer. I'm really sorry, Raja.
No, it's fine. Thank you very much for your insight. It was really helpful. So the next question is directed to Mr. Hemal. So now, let's say I'm a person who hasn't done any sports at school, and I'm not an active person. I don't exercise. I don't do anything. I don't do any physical activities. So would that affect me more because I'm not an active person? Would that affect me more?
Yes, Iransh, it's like this. As Dr. Naman said, the long explanation on the COVID-19, it's actually something to do with the immunity system, not how much you physically active. It doesn't mean that although you have the big muscles and you have a lot of pounds in your body, the COVID will not affect you. The COVID is something that affect your immunity. So if we are strong enough, if we are strong with our immunity, uh, we can prevent from the COVID-19. But your question is, although I do exercises every day, or I'm not doing the exercises every day, it doesn't affect on our the spreading of the COVID-19. But we can prevent. It's like this. Now you can see we see during past 2 weeks there are a lot of bodybuilders has died in Sri Lanka as well as all over the country. But they are in their BMI, they are in good diet, they have a good physical health, but it affected on their immunity. So what we have to do in this situation, Iransha, we can perform some physical activity that does not affect our immunity system, but we can improve our physical activity in order to build up the physical strength. So if we build up our physical strength, Iransha, we can we can strengthen our immunity system as well. If I can share my screen, Iransha, I can show you the physical activity that can be performed. By at our home. So once you have tested and positive COVID-19, we do not straight away go to the gym and do starting our physical activity at once. We have to consult our physical trainer and get the things to be done. What are the exercises that we can do and how much our immunity level has dropped. So on that point, we can gather some information and start with the periodization. So as warm-up exercises, we can do some shoulder shrugs, knee lifts, side bends, and shoulder circles in order to warming up our body, and also ankle taps and ankle circles to warm up our body. So after that, we can gradually go to the increase our heart rate. For that, we have to do the warm-up exercises. So we can start with the marching on the spot, and also the step-up exercises. If we are strong enough and if we do not have osteoporosis or osteoarthritis, you can do some step-up on the stairs. So so these are the basic things we can do to start our physical health rather than going straight away to the gym. So so your question is, Iransha, inactive and active does not matter to the COVID-19. It matters how much our immunity level is strong. In order to build up our immunity levels, Iransha, we can perform some physical activity, because you know that the evidence has proven physical activity can build up the immunity level in our body. So for that, it doesn't mean that physical activity is lifting pounds of weight, and high resistance training has to be performed, and high intensity or high vigorous training has to be performed in order to build up our immunity. As I said, we can start up with small activities and we can build up heart rate gradually, and after that we can go straight to the intensity workout as well. But before that, you have to consult a doctor and get the things done. I mean, you can do some screen test. You can get your lungs tested, and also your blood tested. If you are okay with that, your immunity has come up to mark, then okay, you can go to the trainer and periodize yourself in order to proceed with the physical activity. So I hope I answered your questions.
Yes, thank you very much. So the next question is directed to both of you, Dr. Namal and Mr. Hemal. Now, even I've seen in videos, people in the health industry, they're telling that if you are anxious, if you are scared, you will definitely get COVID. And if you have COVID, it's gonna make it worse. And I think a lot of people believe in that concept. So I'd like to ask you, this mental health affect our physical health in this situation. So first, Dr. Namal can proceed.
Okay. Say, for example, like if you think you have it, you will definitely be frightened about it, because the videos that you have seen on Facebook or YouTube or in your channels, you have seen people die on the spot. They get electric shock, or if they fall and they die. Whereas like those kind of I saw the Chernobyl, the gas leak that happened in India also being provoked and shown in certain videos as the people dying from this thing and all that. Like there's a lot of people are being misled actually. But if I'm to tell you again, give you a short answer about, like, if you think you have it, or else like if you are psychologically affected, definitely your immunity will get affected. There's an indirect relationship between your psychology as well as like it's positively as well as negatively. Like if you think positively, saying that you can do something, you can do something, right? So it affects you. Say for example, if you are going to run 100 meters and if Usain Bolt says I will do it, definitely I can do it, and he will definitely do it. So so then again, like if you are going to lift up 10 kg or 20 kg in the gym, and you say you can't do this, you cannot do it. But if you are strong enough, mentally strong enough, if you get some guy to support you, definitely you can achieve it. So there's a relationship in that. So if you believe, and also like I'm not trying to tell you guys to be fools, saying that I will not get this and go out there and like have fun and come back and other day you end up with fever and cough and you die, is something that you have to prevent. Okay, so so it's about like you having a balanced mentality at the moment, saying that like I know a few people like from the sports institute who are very strong in their physique, who are very strong in their physical training, but they were very careless about like wearing masks or practicing social distancing. So they got COVID, and they really got bad with their lungs. Okay, so their exercise performance reduced very badly. So be worried about this situation. Be worried about what you do. So your psychology also matters, like not being so alert and not being so hyper in terms of your mentality, but also having a balanced mentality, saying that I might get this, and I have to be very careful. Okay, I got the vaccine, I am 2 doses done, so I'm okay to move to the society. Okay, but like still I cannot remove my mask with the crowd. I have to, like, for example, if I'm meeting 20 people, I had to reduce down to 1 or 2 3 people and come back home. When I'm coming back home, what to do, like how to prevent from meeting like my kids directly, or like meeting my grandparents directly, and not going to the common areas. So like you need to practice a lot. So this discipline must be there. So if you don't practice this, don't expect the government. I'm not an anti-government person or towards the government person. I'm very neutral person in most of the decisions that the seniors make in terms of the country being led forward. But you have to safeguard yourself. Don't expect other people to like help you much. So the knowledge that you gain from these forum is very important. So if you have any questions, just ask me directly. I think like there'll be a Q&A session at the end of the program. So your mental really matters a lot. I think Hemal can add some more into the things that I told right now, because the question was directed to Hemal as well. Hemal?
Yes, doctor, I totally agree with the Dr. Namal, because having good physique does not mean that you are health enough, then you are okay. You are not getting COVID-19. It doesn't mean at all. If you think like that, you are foolish. So I totally agree with Dr. Namal. Basically, physical and mental activities are both important for protecting our thinking skills and warding off dimension. But does one triumph the other? It's an interesting question, doctor, because you know that physical and mental health also physical. In order to stay physically healthy, our mentality should also be healthy. So as doctor said, if you think that you are okay with the physique, if you remove your mask and you go around, you go to the gym, you go for walking, you go with your girlfriend for outing, that mean you are not you are a foolish, right? You are a brainless person. So what we have to do in this situation is to balance these two things, physical health and mental health. We have to balance these two things and go forward until the medical sectors and the superiors are finding solution for this.
Okay, thank you very much. So the next question is also directed to both of you. After being tested positive, what are the long-term effects on our health after you get COVID?
Let me just share my screen and show you a slide on that. Hold on. So I hope you guys can see my screen.
Yes.
Okay, so this shows how SARS-CoV-2 virus is affecting your body. So if I'm to tell you about the short-term and the long-term effects of COVID, okay, so I think like you guys can see this very clearly. So this is the virus that I told you, the SARS-CoV virus, the COVID virus that we all talk about. So it's an RNA virus and it has all these E proteins on the surface membrane. And also there are spike proteins which are like showing the figure of a corona. And also there's N proteins and also there are M protein inside this virus. So it's a respiratory virus. It enters from your nose or it can enter from your mouth. So from there, it gets bound to these ACE2 receptors on your respiratory epithelium in the nose or in the respiratory tract. Program down there, like if you can see my cursor. So it gets inside your normal host cell. So when it goes in, it starts replicating and it multiplies. Okay. So as a normal immune response, the body usually attack these viruses by the macrophages, as well as there are natural killer cells, or you can call it NK cells. That's your innate immunity. That's where this actually, you not being a diabetic or you not being a hypertensive or a person who has high cholesterol. So your innate immunity has to do with a lot of these comorbidities. So if you are not a person who drinks a lot, who doesn't smoke a lot, okay, who practice good health and who eat healthy, so your natural immunity is very high. So sometimes you might not get the disease. So if we really look at the population where the COVID attacks is so you can see from this slide, a lot of deaths have occurred in the age group of 60 above. Okay, so it's basically a disease of the elderly. But if you get corona, there is for you there's a. So if you can see from this slide, so if you compare your age with 18 to 19 years being the comparison age group, okay. So when you grow older, you can see the hospitalization. If you get COVID, there's like more than twice chance from a person of 30 years, like for a 40-year-old to get admitted. And also there's fourfold death rise in the people who are more elderly. So if you go up the 60 years, there's five times chance of you being hospitalized. And if you really look at the death is more than 90 times higher than the people who are around 30 years of age. But if you are a young person, like 0 to 4 years or 5 to 17 years, like if you are a young person, there is less, the risk is reduced from 9 folds to 4 folds. Okay. And also the death is also reduced. So like you see So this is how the meta-analysis has been done on the patients who got the disease and who got hospitalized and who died. So if you really look at it, like if you are an elderly person who are above 70, there's 220% chance that you are going to die. So that's why this vaccine program was basically rolled out on the elderly population, those who are above 60. You guys might think that why the elderly are being vaccinated. So why not the young people, like who are all energetic and who do the economy driven, who drive the economy and all that. But like the deaths and the hospitalizations, if we can prevent these deaths and the hospitalizations, we can save a lot of people as well as a lot of money for oxygen care as well as this. That's why this vaccination program is basically focused on the more towards the elderly people and above 30. So so if I'm to go back to my slide, because you are asking about the long term and the short term, the complications of COVID, how can affect your psychology as well as your physical health. So if I'm to go back to my story, because I know you guys do not have a huge amount of knowledge in terms of the body's anatomy, but physiology. But if you know this little bit, I think that's good for you as a person, because this discussion comes very often in terms of you guys hearing about COVID all the time. So if I'm there to like give you more information about your human body as well as a doctor, so I think like this knowledge will be important for you. So you can see these macrophages like trying to kill these viruses by putting up their proteins to prevent this virus from spreading inside the body, as well as to kill them inside the body. So once the virus is killed inside the body, it goes into a memory phase. So the COVID virus is remembered by the body. If you reinfect back again, the antibodies that are formed after your first infection are there to safeguard you. So what they say is basically for about 6 to 8 months, if you get COVID, there's a high chance that you might not get the same COVID in about 6 to 8 months. So talking about the same COVID, you might ask, what is the same COVID business? Okay. So if I'm to tell you a little bit more about the types here, so there are many types. So you know that Delta is the most bad killer at the moment in Sri Lanka. It's all over the world. If you say New Zealand, South Africa, India, Australia, United Kingdom, Italy, the Delta is the most prevalent and most virulent at the moment. And hello?
Yes, can hear you.
Okay, so Delta, and there's Alpha variant, and there is Eta variant, and there's Lambda, Beta, Epsilon, Gamma, Kappa, and there are a lot of variants. So if you read about Sri Lanka, so 88% of the people are being infected with Delta at the moment, and Alpha has been there for a long time. So if you get Delta, there's high chance that you will not get Delta after about 8 months. Like the high chance you will get prevention. So your natural body immunity helps you to prevent from getting Delta back again in a shorter period of time for about 8 months. So then again, if you look at those are the short-term like preventive measures that we can do. So example, you will not get the infection back again, but there is always a chance that you may get reinfected with COVID again and again, because you know dengue being a viral disease in Sri Lanka, which has killed so many people in 2009 and 2017. So there are 4 dengue types of dengue types. So like you can get reinfected with dengue again and again. So you need to be very careful about getting COVID as well as going back. So this illness basically affects your lung. So that's what I'm going to say here. So it goes into your lung and it prevents this oxygen and oxygen being mixed with blood. So that's why we have these pulse oximeters most of the time to detect where the oxygen delivery is affected. So basically when you get the disease, it's not the virus that is going to kill you. So it's actually the pneumonia as well as the other comorbidities. If you see the deaths here, so more than 75%, around 75% people have died who had comorbidities, who had pre-existing lung disease, pre-existing diabetes, pre-existing medical conditions. They have died from COVID after getting COVID. But only 25% of the people died from COVID pneumonia. But at the moment, COVID pneumonia is up on the run with the Delta variant. So pneumonia is basically like your lungs are stiff and it has a lot of secretions inside. So one day one person asked me whether we can put something inside the lung and suck the secretions out. Of course, like those are possible, but like this mucus, these thick secretions are covering your alveoli. Those are the most outer part of the lung where your oxygen get delivered directly from your respiratory system. So when you have a lot of mucus, a lot of secretions, the oxygen that is in the inspired air. When you breathe oxygen, so that oxygen is not reaching your lung. That's why the people are being connected to machines. Oxygen are delivered from cylinders with high pressures. So that's why we make sure that adequate oxygen saturation is maintained, because like you all see this high fancy gadget called the pulse oximeter. We actually learned those things in my era when I went to the medical college. So, but now you guys, like being a 16-year-old, 18-year-old, you guys know what a pulse oximeter is all about. So it actually detects your arterial oxygen. So it's a pulsatile wave that is going to detect it from an infrared light that is in the pulse oximeter. So it says how much of oxygen is there in your body in a crude way, but not on an exact way. But if you want to know exactly, you need to get a blood sample and you need to run in a machine. But in an indirect way, your pulse oximeter detects your lungs, the blood oxygen saturation. So basically, like when you're infected with COVID, your lungs get bad with pneumonia. Okay, so in the long run, your lungs go into a state of fibrosis. So the lungs are not in a position to like give adequate oxygen to the organs inside your body, starting from your brain, for your kidneys, for your livers, and all your muscles. So as Hemal very well said, like you need to have a good muscle activity. Like if you need to have good muscles, you need to have oxygen. So if you start working out with mild to moderate intensity, sometimes your oxygen that is delivered to your muscles may not be adequate when you get COVID and when you end up with a bad COVID. Not all the COVIDs, not the mild cases, not the mild symptomatic cases who can be managed at home. Okay, with giving simple antibiotics, simple supplements, we can manage COVID at home, but not by the ready-made regimes that you get from your WhatsApp messages or from your social medias. But you have to be, it has to be customized according to the patient needs. So, but if you end up in a high treatment unit, or you end up in hospital, or you go to ICU, when you recover, that becomes a serious infection where you actually can, you must have a quarantine period of more than 14 to 21 days. But you are mildly infected with a mild COVID, the quarantine period can be like less than 10 days, like around 10 days. So you can go back to work. But the PCRs may not be negative when you go out after getting COVID for the first time. So you will be like, for you to get a negative report, it sometimes takes about 1 or 2 months. Okay, so your lungs are basically affected with the primary COVID. If you get a serious infection, then again this virus can go to your bloodstream and can provoke bacterial infections from yourself. So when the bacteria is there, you need to get antibiotics. Okay, so since this is a viral disease, sometimes some people may ask me why the antibiotics are given. It's given actually to prevent from secondary bacterial infection. So so there is a lot of what you call after effects of COVID, say long COVID and the post-COVID thing. Some people tend to say that there is a lot of what you call cases where some blood clots were formed and the people have ended up with deep vein thrombosis, like there is small clots being formed in your legs, as well as those get shoot up in your heart and in your brain, where they had heart attacks and strokes and have died. So there are a lot of long COVID and post-COVID syndromes that are being researched at the moment. So it's a very nasty disease. So the basic idea that you guys should have at the moment is not to get that. So to be very careful at the moment after getting the vaccine. So practice these 3 methods: hand washing, social distancing, and also wearing the mask all the time. So, so I think you guys got some idea about the disease itself and also the long-term complications. So you have to slowly move on to physical activities. So if you know how your lung works, if you know how your heart works, and if you know how your muscle pump works, and this is and oxygen is required at each and every point, because lack of oxygen kills you within seconds. Okay, so it has to be very well kept into your head. So as Hemal said, like to start your physical activities, if you are infected with COVID, you at least should have some idea about your oxygen state in your body. So if you are 99, 95 above, like in room air saturation oxygen, so that's really good. But if you are working out also, if you are getting repeatedly exhausted, or if you are repeatedly getting fatigued, so that has to be checked whether your lung functions are getting bad or whether your heart functions are getting bad, or at least like, because there has been cases of a lot of post-viral myositis conditions where your muscles are being affected directly rather than your heart and rather than your lungs. So you need to get your muscle enzymes checked as well. So if you are having symptoms after getting corona, I think that has to be checked like immediately, like if you are into physical training, recreational, or else like functionally. Hemal, if you are to add something there.
Yes, Dr. Jasmine gave a vast medical approach to the question, Iransha. So adding to that, Doctor, as Dr. Namal said, the side effects and the symptoms that we can see after COVID-19 affected, basically some people experience a range of new or ongoing symptoms that can last week or a month after first being affected with the virus, Doctor. So unlike some of the other type of post-COVID condition that only tend to occur in people who have had severe illness, the symptoms can happen to anyone who have had COVID-19, even if the illness was mild, or if they had no initial symptoms. People commonly report the experiencing different combination of the symptoms, like the difficulty of breathing, shortness of breathing, tiredness or fatigue, symptoms like getting worse after physical or mental activities, especially the physical activities, and also the difficulty of thinking or concentrating on something, especially on the school children, cough, chest pain or stomach pain, and headache. So those symptoms can be seen after COVID-19, the post-COVID-19 conditions, as post-COVID-19 conditions. So as a physical trainer, in order to give a physical approach for that, basically, if, as I said from my very beginning of my conversation, once you once you tested the negative COVID-19 after you affected with COVID, it does not mean that you are okay and you can go and lift your pounds of weight. As I said, you go to the professional fitness instructor and periodize yourself, because as doctor said, and as I'm saying, after getting COVID-19, and you can still have the side effects on this disease, and especially if it is physical related post conditions, the symptoms like the worse after the physical health will be worse. You can, if you like climb some stairs, after climbing that you will feel that you are exhausted, you can't do more, and the joint arm muscles are paining, or even you can get a light headache. So your heart is okay, but your body does not allow you to do the activities. So what you have to do is, as doctor said, you have to go to the doctor again and get the things to be done, what you have to do. And also it has to be done at as step by step, not at once. Yes, you can share my screen again. So these are the guidelines that I can give you. Can you guys see my screen? No. Iransha, can you see my screen?
Mr. Hema, we can't see the screen.
No.
Okay. Okay, anyhow, it doesn't allow me to share my screen. Fine. The worst post condition is the fatigue, muscles fatigue, as well as the shortness of breathing, and also the muscle pain. The chronic fatigue can be classified as the fatigue lasting more than 6 weeks, the impact of fatigue is more than just lower productivity. Who can manage your fatigue through planning for demanding and repetitive tasks, and also regular scheduled breaks during the day allow for both physical and mental restoration, as well as social distancing. Days off during weeks, plan your day like schedule to allow your better plan for completing your work, as well as sleep between work periods. So and if you are a teetotaler, the smoker, you can still reduce, and you have to understand the risk of this disease, and you can still stop that, or you can seize it, or you can manage that control. Okay, I can see my screen now. And also doctor will discuss how diet has to be done, and what are the convenient foods that we can eat during the COVID-19, and also after you infected and you tested negative COVID, and what are the foods that we that are good to help to build up our immunity. So here are the regaining your strength. So the basically taking support from your family members and friends. So as we said, this COVID can affect our health as well as our mental. Now in this society, if we say that I'm tested and positive COVID-19, the social or the community thinks that I am tested and positive AIDS. So it doesn't mean that AIDS and COVID-19 are similar diseases, though they are caused with the virus. So we have to share our feelings. We have to get the support from the family, and also the regaining program has to be periodized by the professional trainer. And also frequently we have to use the items in easily accessible places, like the equipment that we need to do, the equipment we use to do exercises, and reorganizing some things in your life so that they require less energy over the next few weeks and months while you recover. Organizing daily routine to allow completion of essential activity when you have most energy. So these are the topics that we can highlight on regaining our strength step by step. Iransha.
Okay, thank you very much. Before we proceed, if the audience have any questions, you can forward it to the chat box, and and the speakers will answer to you. So we are going to the last bit of questions, and it will be related to vaccines. So we'd like if Dr. Nama would answer this. So the first question is, if somebody is planning to go overseas, what are there any restrictions regarding these vaccines if somebody is going overseas?
Actually, no, because you might disagree with me, because the problem is with Sinopharm. Okay, people tend to ask, like, I got the Sinopharm and the people are like not giving me visa, or the countries are not accepting me. That is true, but like countries not allowing you to go, like you cannot go freely to the country. For example, you can go, but you have to get a hotel quarantine for about 14 to 15 days, whatever the guidelines as per them. Okay, so you can go with the Sinopharm vaccine, but then again, like after getting hotel quarantine, you will have to get a vaccine approved in that country, because some of the countries have not approved Sinopharm, even though Sri Lanka had a huge struggle when Sinopharm was brought in, because I know that personally, when Sinopharm is brought in, there was lack of clinical trial data. Because like you need to have a certain clinical trials done, pre-clinical testing, phase 1 studies, phase 2 studies, and phase 3 studies, and so on. So these studies were not properly. The clinical trials did not have enough proof for the National Medicines Regulatory Authority to approve the vaccine at that point when it was brought into Sri Lanka by the Chinese government. So like the approval was a little bit delayed. But then again, like the NMRA approved Sinopharm vaccine, so they got the vaccine. Now the majority of people have got Sinopharm in Sri Lanka. But the thing is that the clinical data is still not available in certain countries. So because they have to submit these to EMA, European Medical Association, or the Federal Drug Authority to get the approval. But currently the Sinopharm, both Wuhan and the other the Beijing, both vaccines have been submitted. So I think they are at the verge of getting the approval. So I don't think it will be a problem for you guys to try to travel, even getting Sinopharm. And also, but certain countries have regulations for other vaccines like Johnson and Johnson, Pfizer, Moderna, and Sputnik. And so even some of the countries do not accept Sputnik as well. So they are basically into AstraZeneca, Sinopharm, Pfizer, and Moderna, and Johnson and Johnson. So having said, if you have got Sinopharm and if you are going to plan to travel abroad, so don't worry about it. Like you can go abroad, but you have to go for the hotel quarantine period. Then again, like you need to get a vaccine afterwards once you enter into that country. I hope that answers.
Yeah. Thank you very much.
Just to clarify that, doctor. So
Yeah. I think he paused. Okay, so we'll proceed with the next question. It's now I got the Pfizer vaccine. I got both the doses, and so from the day I got it, all my friends are asking where I got it because they need Pfizer, and if they don't get Pfizer, they won't be vaccinated. So I think that's a huge problem the society has now, because I personally believe that you have to get vaccinated to improve the situation. So what is your take on it?
Yeah, Iransha, basically like you need to get a vaccine which is available in your area as early as possible. So you should not go behind Pfizer, or you should not go behind Moderna. You should actually get the vaccine that is available in your area. But if you are given a chance to get a Pfizer or a Moderna or a Johnson and Johnson, that's basically that's luck. But that doesn't mean that the Sinopharm is inferior. Okay, so Sri Lankan population, when the Jawaharlal University did a research on the antibody levels, it was proven that more than 95% of the people who got Sinopharm has adequate level of antibodies to fight the illness. Okay, so don't worry about it. But like long-term effectiveness of these vaccines are a little bit doubtful. For example, like some of the people, like about the flu vaccines, right? So there are flu jabs given for people who elderly people, those who travel. So annually there are flu vaccines given to most of the people who are not living in the tropical areas in the world, but those who are exposed to extreme weathers. Lots of people die with flu, so they are given vaccines to prevent them from getting the viral flus. So just like that, it's been a discussion going on that Sinopharm third dose or the second booster may have to be given into certain populations in our country, or else like Pfizer again or AstraZeneca again, because we have seen quite a lot of vaccines tailing down from their effectiveness over a long period of time of 6 to 8 months. Okay, so it may be an annual vaccination for most of the risk people. Sometimes it can be health or the military people or the elderly people who are more than 60 years of age, or who have liver or kidney disease or chronic illnesses. Okay, so it's about new clinical trial data. So we need to do a lot of trials, get evidence-based practices. So that's why I'm not against the Ayurvedic and the indigenous medicine in Sri Lanka. So the doctors in Sri Lanka, you guys may want to ask whether these natural remedies, all these herbals, or else like the tel and the penny and all that will be effective on preventing COVID. But if they do a good clinical trial, if they do a good scientific methodology analysis, I'm definitely like the Western doctors are not against the Sri Lankan Ayurvedic or the national what do you call that, it's not Ayurvedic, it's actually Helavedakama. So it's not, people are not against that. So people are actually like in favor of these things. If at all possible, if there are scientific practices that can be brought into develop these things, it will be really helpful. Like if you say that this tea is going to help you, or this product is going to help you, that is really good in Sri Lanka. If at all possible, if we can get those things up. So these are all Western vaccines. I think like still so far there has not been any solution apart from the vaccine to prevent this disease, as well as prevent it from progressing.
So this is also people are very curious about this. It's that what are the long-term effects that we get? Are we getting any long-term effects if we get the vaccines?
No, not really at the moment. Okay, so don't worry about getting the vaccine, because we have been jabbed, we have been vaccinated. If you can see this slide, okay, so only thing that I have to say about RNA vaccines, that's Pfizer and Moderna, Pfizer BioNTech and Moderna. So it was no other licensed vaccine. If you can see my right hand side, so other vaccines using the same technology. Okay, so it's a RNA vaccine. So there was a huge discussion going on. I remember about like 1 year back about the RNA vaccines. Like people were saying that the humans will not be able to develop a RNA vaccine ever, because like earlier the MERS and the SARS, they were not controlled by vaccines. Like we were using certain monoclonal antibodies and antibiotics to prevent these illnesses from spreading, as well as prevent its complications. So this Moderna as well as Pfizer, it uses a RNA technology to vaccinate. And also, if you look at the viral vector vaccine, that's of course Oxford AstraZeneca and Gamaleya and Johnson and Johnson. They are actually part of Ebola vaccine. Like the Ebola vaccine has the same technology, so they use viral vectors to give the vaccine. And also, for example, the whole virus is given in an inactivated form by Bharat Biotech. Inactivated and Sinopharm inactivated. So these are all the whole virus has been given to the body in the inactivated form. And also, like you can get these protein subunits as well. So there are certain vaccines, like vaccines used against hepatitis B. And also, like if you see here, the Sinopharm that was given, so the same constituents, adjuvants, everything is there in the whooping cough vaccine, and rabies vaccine, and hepatitis A, and the human papilloma vaccine. These vaccines are being commonly used for a very long period of time. So, so we cannot expect any long-term side effects at the moment. So there are a lot of research and studies going on. So I think it's a point that we have to keep open for the long-term side effects. But for the short-term side effects, of course, like those who have got AstraZeneca or those who got Pfizer may know that first dose and the second dose, how difficult it was, because they are all what you call using the viral vectors. So it's not a killed vaccine, it's not an inactivated vaccine. So that's why all the pregnant mothers and the breastfeeding mothers were requested, or like they were said given a go green or given an okay to get the Sinopharm vaccine, which is an inactivated vaccine. So so these inactive, so those who got Sinopharm, for most of the time, like more than like 75 to 80% of the people did not have any side effects. They only got a little bit of shoulder pain or a little bit of slight headache. But like when you compare with AstraZeneca and Pfizer, there was like hardly any side effects on the people who got the Sinopharm vaccine. So long-term side effects, like something that we have to keep the flow open for some time, because it's all happening at the moment about the medical research and getting more details about the post marketing surveillance plans on these vaccines which have been implemented. So I think there'll be a time that we need to like report certain things, but I really don't think there'll be like long-term adverse events where these Moderna is going to control yourself with 5G technology and the luciferase and stuff like that. It's all a myth at the moment. Some of you guys may disagree, those who know a little bit more about engineering and nanoparticles and all that, but it's not a fact.
Okay, thank you very much, Dr. Namal and Mr. Hemal. So next, our president will do the vote of thanks.
Right, thank you, Iransha. I want to thank the speakers, Dr. Namal and Mr. Hemal, for taking their time off their weekend to join with us and give us a very informative session. And also I want to thank all the participants who joined us for this webinar session. And also especially I should give some thanks to the organizing committee, Mark, Rakita, Manusha, and Sedija, who were really involved in this organizing and, coordinating this. So yes, thank you everyone, and have a nice week. Yeah, stay safe. Over to you, Ransha.
So now we for a token of appreciation, a digital token of appreciation, we've arranged something like this. Now Madhav will share it on the screen. So this is to appreciate appreciate Dr. Namal for being here today and giving us valuable time to educate us in a topic that we are really curious about. So this is to appreciate Mr. Hema for being here today. I know both of you have a really busy schedule. So thank you very much for educating us with your knowledge.
Thank you very much.
Thank you, Rajan. Thanks for having us. Good night, everyone.
Thank you very much, and good night to everyone.
Thank you everyone for being here. So we'll end the webinar now. So until next time, see you.
See you all, and stay safe and stay healthy. Good night all.